Hi, my name is Greg Mullen, and I will be talking to you today about living with Down syndrome. Most of us, if not all of us, know someone or have seen someone that has been affected by Down syndrome. My goal today is to share with you information or to provide you with information that will help enlighten you to the fact that Down syndrome does not necessarily have to be a limited disability. I will also share with you the symptoms that causes the doctor to believe that your child has Down syndrome, as well as the effects that Down syndrome have on the people that have it, and the treatment that can accommodate people to help them live with Down syndrome. Now, Down syndrome is a genetic condition that is characterized by its typical features. It received its name from Dr. Langdon Downs, who first described its features in 1866. One in every 631 live births is a child that has Down syndrome. That represents over 5,000 births per year. There are over 400,000 people in the United States alone that lives with Down syndrome. Now, there's a higher risk for a child to be born with Down syndrome when it's born to a mother that is 35 years of age or older. Now, however, 80% of the children that are born with Down syndrome are born to mothers that are less than 35. That is because there are more women giving birth to children that are less than 35 years old. Now, imagine yourself, if you have four children that were born perfectly healthy, and now you go to the doctor you go to the delivery room to deliver a fifth child, and the doctor tells you, I see features, or I believe that this child has Down syndrome. How would you feel? What would you do? What would your thought pattern be? Would you be aware of the symptoms? Would you be aware of the effects? Or would you be aware that there is treatment or there is help that your child can receive? Now, the symptoms of this: there's a decreased muscle tone. The muscles are not as strong, they're not as tight. The facial muscles, the skin sort of droops. The eyes are sometimes slanted upwards, and the ears are small, and sometimes they flop over, or they creased over at the top. The hands, you will have, rather than having more than one line, the hand will have a single crease in the palm rather than having lines all over the palm of the hand. So there are various things that the doctors look at and make the determination that this child, there's a strong possibility that this child has Down syndrome. But after doing that, because of what they see in the symptoms, they would then send off for lab results to find out does the child actually has Down syndrome. Now, how does Down syndrome affect my child? The effects of Down syndrome can be a delayed mental and social development. They can have impulsive behavior, poor judgment, short attention span. They can be slow to learn. They can have heart problems and impaired vision, impaired hearing, various things that can be wrong with the child, and many of which can be corrected. Many of the children have to go through surgery. They have to wear eyeglasses and whatnot at an early age. Sometimes even have to have hearing aids. So therefore, it is important that because of the effects that Down syndrome have, it is important that we understand there is treatment. Now, there is no cure for Down syndrome, but there are things that can be done to help the child to live with Down syndrome and very possibly live a normal life. Those things are the treatment that is designed. First of all, there needs to be early intervention. In other words, the child needs to be starting to be trained, to need to be worked with at a very early age, as early as possible. The child needs to get early intervention. What the early intervention consists of is physical therapy, occupational therapy, as well as speech therapy. Now, the physical therapy helps build the muscles. As I told you earlier, that the muscle tone is very loose and they're tight. So therefore, the children are not able to sit up like they should. Because of the low muscle tone in the abdominal region, they don't have the strength to pull themselves or hold themselves up to sit. So physical therapy helps build these muscles, and so that they'll be able to do things that a normal child does. Sometimes that is delayed, but the earlier the child gets the earlier intervention, the better it is, and it helps the child to be able to develop even faster. Now, also the occupational therapy, because of the low muscle tone, helps the child to develop better eating skills and drinking skills. Because of the low muscle tone, the child is not able to latch on. The mouth, the muscles in the mouth are loose, and so they're not able to suck the way they need to feed off the bottle and whatnot. So therefore, the occupational therapy helps to develop these skills so that the child can eat and drink properly and keep the weight the way that it should be. Now, the speech therapy as well. Children with Down syndrome are not always able to speak clearly because, again, the low muscle tone in the tongue. The tongue does not operate the way the normal tongue does. So there are ways that they work on the mouth and the tongue to help the child to be able to develop the speech as well. Now, again, Down syndrome does not have to be a limited disability. If we are made aware of the things that we need to know, then we can be better able to deal with it. So in conclusion, I've given you the symptoms, I've given you the effects, I've given you the treatment, the things that can accommodate people with Down syndrome to help them to live a better life. So therefore, from this day forward, if anyone in this room is affected by Down syndrome, you will now know that there is hope, and you don't have to give up on your child, because the only limits that they will have are the ones that you put on them. Thank you.